right, well, greetings and welcome to our series of interviews. My name is Mark Edworthy, and I am the City Rise Network Director. And I have the privilege tonight to interview Dr. Anthony Brissett, who is a medical provider for Casa. He also sits on the board and serves as the medical director. So many different roles. So Anthony, take a moment to please introduce yourself.
Well, thanks. Your introduction, really kind of shares the involvement that I've had at Casa for the past 10 to 12 years. So currently, my specialty is head and neck surgery, but specifically facial plastic and reconstructive surgery. I was on faculty at Baylor for about 15 years and then have been blessed with the opportunity to develop the practice at the Methodist Hospital. But we are focused on Casa today, and so Casa is an organization that I've been involved with from the very beginning when Dr. Spann and Royce Hassel and Barry Landrum presented this idea to our congregation. It was something that I was immediately attracted to. I was serving in a variety of ways around the world, doing mission work in Russia or Africa or even in some Asian countries as well. But those missions really provided just a small opportunity of time, a week here, 2 weeks there throughout the year. And so when the opportunity for Casa presented itself, it really allowed me to provide service in a continuous way. And we live in one of the largest cities in the country. We live and I work in the largest medical center in the world. But right in the shadows of the Texas Medical Center are millions of people that don't have access to some of the high quality care that we provide just miles away. So that was really part of the motivation for me to jump on board to Casa.
Well, super. You have over a decade of memories. Does one stick out? Maybe a patient you've treated or an experience you've had over this last decade as you've served at Casa?
Well, I can't say that one specific patient really kind of jumps out to me. And it's interesting because I find that I am influenced by Casa, and Casa influences people in a variety of ways. And so, patients are blessed by Casa, and there are several patients that I've had the opportunity to care for that I can clearly see have benefited. But I also see Casa benefiting our congregation and having opportunities to serve and to help people in our community. And I see it helping our volunteers. And so, there are a variety of aspects to Casa that I think really allow us to glorify God, really allow us to honor Him, and we are blessed in a variety of ways because He serves and motivates everybody that comes through those doors.
All right, one more question. We have seen Casa come so far in the last 12 years, but we're standing at a threshold now. What do you see tomorrow in the coming months, years for Casa El Buen Samaritano?
Well, I think the best opportunities are yet to come for Casa. And in the midst of this chaos that we're going through with COVID and our pandemic, I'm seeing God work in miraculous ways. Even though we are quarantined and shut in, the reach that we have through Casa with the use of technology has just exploded. And so we are able to see, and in fact, we are seeing more patients through our virtual platform than we've seen previously. Additionally, we're able to reach the entire state through our volunteers as well as through our patients, which we haven't been able to do either. And so I think that the future for Casa has really blossomed in the face of COVID, and God has just really worked miracles in the midst of this storm. But additionally, I think that your involvement and your addition to our Casa purpose and our Casa mission, to me, is an exciting next step because we'll expand. We will expand our footprint. We will expand to a different location. And as a result, that means we will also expand to a different demographic. And we have been focused primarily on Latino and Hispanic population, and we have served them beautifully. But there are cultures around this city that can also benefit from hearing the gospel and receiving our care. And so I look forward to expanding that care to other cultures, to other subgroups, to other demographics throughout our city and throughout our state. And I'm excited to see that happen, not just through Casa, but also with you coming alongside us.
Well, thank you. And Casa's best days are ahead. Thank you for joining us, for watching this brief interview. And if you have any questions, give Casa a call. We still are always looking for volunteers and for partners. God bless you.